As a parent, there's nothing more heart-wrenching than seeing your child in discomfort or pain. And when it comes to allergies and sensitivities, it can be particularly challenging to know how to help them. Infants are particularly susceptible to allergies and sensitivities, and as a parent or caregiver, it's essential to understand the signs, symptoms, and causes of these conditions. Infant allergies and sensitivities can manifest in many ways, including rashes, hives, vomiting, diarrhea, and difficulty breathing. These symptoms can be frightening and overwhelming for both the child and the parent. Additionally, it can be challenging to pinpoint the exact cause of the reaction, which can lead to frustration and anxiety. The good news is that with the right knowledge and resources, you can help your child manage their allergies and sensitivities, and in some cases, even prevent them from occurring altogether. In this video, we'll explore the world of infant allergies and sensitivities, including the common allergens, causes, and treatments. We'll also share some tips on how to keep your child safe and healthy. Let's start by understanding what an allergy is. An allergy is an abnormal immune system response to a substance that is typically harmless to most people. This substance is called an allergen, and it can be anything from food to pollen to pet dander. When an infant's immune system reacts to an allergen, it releases chemicals that cause the symptoms we associate with allergies. Infant allergies can be divided into three main categories: food allergies, environmental allergies, and contact allergies. Food allergies are the most common type of allergy in infants, and they can be life-threatening in some cases. The most common food allergens for infants are milk, eggs, peanuts, soy, wheat, and tree nuts. Environmental allergies, on the other hand, are caused by exposure to substances in the environment, such as pollen, dust mites, and pet dander. Environmental allergies can cause symptoms such as sneezing, runny nose, and itchy eyes. Contact allergies occur when an infant's skin comes into contact with an irritant such as certain soaps, lotions, or fabrics. Contact allergies can cause rashes, hives, and itching. Now that we've covered the different types of allergies, let's look at some of the causes of infant allergies. There's no single cause of infant allergies, but there are several factors that can contribute to the development of allergies. Genetics plays a significant role, and infants with a family history of allergies are more likely to develop allergies themselves. Other factors include exposure to allergens at a young age, a weakened immune system, and the introduction of solid foods too early. So, how do you know if your infant has an allergy or sensitivity? The symptoms can vary depending on the type of allergy, but some common signs include rashes, hives, vomiting, diarrhea, and difficulty breathing. If you suspect that your infant has an allergy or sensitivity, it's essential to speak with your pediatrician as soon as possible. They can help determine the cause of the reaction and develop a plan for managing it. When it comes to managing infant allergies and sensitivities, there are several strategies you can use. If your infant has a food allergy, the best course of action is to avoid the allergen altogether. If your infant has an environmental allergy, you can take steps to reduce their exposure to the allergen. For example, if your infant is allergic to pollen, you can keep the windows closed during allergy season and use an air purifier in your home. For contact allergies, it's essential to identify the irritant and avoid it. You can also use hypoallergenic products to reduce the risk of a reaction. Additionally, there are medications and treatments available that can help manage the symptoms of allergies and sensitivity. Antihistamines are commonly used to reduce symptoms such as itching, sneezing, and runny nose, while epinephrine auto-injectors can be used in cases of severe allergic reactions, such as anaphylaxis. Another important strategy for managing infant allergies and sensitivities is to be prepared. This means having a plan in place in case of an allergic reaction, as well as educating yourself and others on how to recognize and respond to a reaction. If your child has a severe allergy, it's also important to inform their caregivers, such as teachers and babysitters, so that they are aware of the situation and know how to respond if a reaction occurred. In addition to managing allergies and sensitivities, there are also steps you can take to potentially prevent them from occurring in the first place. One approach is to introduce new foods slowly and one at a time, so that if your infant does have a reaction, you can identify the allergen more easily. Breastfeeding may also help reduce the risk of allergies and sensitivities, as breast milk contains antibodies that can help protect your infant's immune system. Finally, it's important to remember that allergies and sensitivities can be a lifelong challenge, and it's essential to work closely with your pediatrician to develop a plan for managing them. This may involve regular checkups and testing to monitor your infant's allergies and sensitivities, as well as adjusting their treatment plan as needed. In conclusion, understanding infant allergies and sensitivities is essential for any parent or caregiver. While allergies and sensitivities can be challenging to manage, with the right knowledge and resources, you can help your child stay healthy and safe. By identifying potential allergens and irritants, developing a plan for managing reactions, and working closely with your pediatrician, you can help ensure that your infant stays healthy and happy. Remember, if you suspect that your infant has an allergy or sensitivity, it's essential to speak with your pediatrician as soon as possible. They can help determine the cause of the reaction and develop a plan for managing it. With the right care and attention, you can help your child thrive, even in the face of allergies and sensitivities.